Hi there, this is Dr. Alicia Gajar, and I wanted to share with you a presentation that I recently gave to a really great group of women for Heart Month, just to inform women everywhere about what heart disease looks like in women, how to prevent it, what to look out for, what to talk to your doctor about, and how our hormones really inform cardiovascular risk in women. It was so well received during the live event that I just felt like it was worth sharing with a broader audience. So here we go. I'm going to share my screen. Okay, so I really wanted to call this presentation, what every person needs to know about cardiovascular disease because this is a global issue. Cardiovascular disease does not just affect women, it affects every person. And I think everybody needs to know how this is different for women so that they are enabled to hopefully step in and potentially save the life of a woman they love. So before we dig in, just a little bit about me. I am a naturopathic doctor and a menopause specialist. I'm certified by the Menopause Society. I got my doctorate in naturopathic medicine from Bastyr University, and I also have a Bachelor of Science in nutrition from Colorado State. I hold memberships in the Washington Association of Naturopathic Physicians, the Menopause Society, and the American Heart Association Circle of Red. I'm also an American Heart Association 2026 Woman of Impact nominee, which just means I'm clearly very passionate about cardiovascular disease and women's health. And this branch of the AHA really focuses on generating awareness for women's specific cardiovascular disease as well as fundraising, because women's cardiovascular disease receives just a minute fraction of all funding. So the AHA has a whole branch called the Circle of Red, and then the Woman of Impact campaign, specifically designed just to raise funds for this crucial purpose. And before we move on, I have to tell you legally that this content, this discussion, it's all for informational purposes only. No doctor-patient relationship is formed, even if I am your doctor. So any information provided here is not medical advice, and you should always discuss your personal medical concerns with your provider. So there are some kind of grim statistics. Heart disease is the number one killer of women. If you combined all cancers together, heart disease would still be the number one killer of women. And it's shocking to me that a, a, a real fraction of the population even knows this. Most women don't know that heart disease is the number one killer of women. Women are also twice as likely to die as men within a year of a heart attack. And until the 90s, most heart disease research was only done on men. So women were not even being researched. The drugs that we give to women for cardiovascular disease were often never even tested in women. And if we can't diagnose it, we don't know how to treat it. That kind of explains why it is the number one killer of women. Women are also just less likely to be taken seriously when they present to the emergency room. They're less likely to receive treatment. They're less likely to even receive CPR. So, because people are so afraid of injuring a woman, or because, they're afraid of exposing their breasts or whatever, women are actually a lot less likely to even receive CPR from a bystander. So the American Heart Association is really trying to change that, and we're really trying to improve research funding. So what does cardiovascular or heart disease even mean? I find that it's just sort of, it's not a sexy term, and nobody really wants to talk about it. Like, what is this kind of vague term, cardiovascular disease? It really just means any disease of the heart and the vessels. This is a combination of plaque and inflammation, which will narrow or block your arteries over time. It could be coronary artery disease. It could be ischemic heart disease. It could be a heart attack, which is a myocardial infarction or an MI. It could be a stroke, it could be heart failure, which can last for years and years. Any of these would be considered heart disease or cardiovascular disease. And there are risk factors that apply to everyone. So having high blood pressure puts you at significantly increased risk for heart disease. Having elevated LDL levels, which is the quote unquote bad cholesterol, smoking at any time for any length of time is an independent risk factor for cardiovascular disease and many other things. Type 2 diabetes will definitely increase risk. I believe that's due to an increase in triglycerides that often comes along with type 2 diabetes. It's also an increase in inflammation, which can drive the disease process. Having increased obesity, especially around the belly area, that indicates an increased amount of visceral fat. So you have subcutaneous fat that's just under the skin, and then you have this visceral fat, which surrounds the organs and the abdomen. That fat is highly inflammatory and directly contributes to heart disease. Being physically inactive is a major contributor to heart disease. Having a poor diet that's really high in processed foods, low in fiber, high in sugar, and then of course family genetics. If there's a long history in your family of people having early heart attacks, in their 40s or 50s, that probably points to a genetic risk factor. And I will say, of all of these, the type 2 diabetes piece, having high blood sugar impacts women more. That's going to impact women even more than men. So, but wait, there's unfortunately there's more. These are issues that affect women more predominantly. So autoimmune diseases like lupus, like RA, those are more common in women, and they do predispose you to heart disease because they are inflammatory states. Um, any kind of pregnancy complication. So if, you say you were pregnant in your 20s and you had preeclampsia or you had gestational diabetes, that strongly increases your likelihood of heart disease 30, 40 years later. So your pregnancy history is actually really important to discuss with your doctor. Depression and chronic stress more than men is, it's linked more strongly to cardiovascular disease in women, even more than men. Um, I think we've all experienced a lot more isolation post-COVID. People are working more. There's more of this chronic stress there's like a loneliness epidemic here that definitely is driving disease processes in women. And then if you have any kind of history like PCOS, which is polycystic ovarian syndrome, if you had early menopause, which would be before the ages of 40 to 45, if you've had migraines with aura, regularly, those are all risk factors for heart disease that are more specific to women. And most of the time, unless there is a strong genetic reason or an anatomical reason, women don't seem to develop heart disease until they're older, whereas men seem to develop it, when they're younger. So why do we think women are at a higher risk of cardiovascular disease in midlife? I don't know if you've ever asked yourself that question. I have. And it's because of menopause. And I'm not here to blame everything on menopause, but menopause is a significant shift in a woman's physiology and in the future of her health. And it needs to be given due attention. So you have receptors in literally every organ of your body for estrogen. And in that menopausal transition, that means every single organ in your body is affected by those hormone fluctuations, including the cardiovascular system. And we often hear about menopause as like, oh, it's just hot flashes and night sweats, no big deal. You can power through it. But those symptoms are actually warning signals from the cardiovascular system. Those are signs of stress on the cardiovascular system, and they actually deserve to be treated. They deserve attention. That's not something we should be pushing through. Your heart, she loves estrogen. Estrogen is a very cardiovascular, supportive hormone. So estrogen keeps your blood vessels really flexible. And this is why women typically don't develop heart disease until they are older, after menopause or during that menopausal transition. It's because estrogen is keeping our blood vessels really flexible. It also raises the good cholesterol, which is HDL, and it can lower the LDL, which is the bad cholesterol. It actually upregulates LDL receptors, and the more receptors you have available, then the faster LDL is going to clear. It helps keep HDL around longer. And then estrogen is essentially an anti-inflammatory, so it's lowering inflammation, and inflammation is part of the heart disease process. It's not just plaque, it's plaque and inflammation. But then in addition to that, you see lower rates of arterial plaques. So estrogen is doing a lot of really beneficial things for us. And so once it all goes away, you're experiencing so many more risk factors. So if estrogen is keeping your arteries, flexible, then you're going to see arterial stiffness. If estrogen is supporting and lowering inflammation and is doing that arterial flexibility, it's upregulating nitric oxide, then you're going to have increases in blood pressure whenever it goes away. You're going to see more LDL. You're going to see a higher rate of visceral fat. We know, we call it the menobelly, right? We know that when women go through menopause, they'll often experience this like midsection weight redistribution. Maybe her weight hasn't changed on the scale, but women will report, I'm just having this like shift in body weight. My pants don't fit right, and it's all in my midsection. That's because with low estrogen, we see an upregulation in visceral fat, which is just going to increase inflammation overall. I promise it's not all doom and gloom. So, what you should know, and what I want everybody to know, is what a heart attack looks like in a woman versus a man. So, you see these movies and like there's a man having a heart attack and it's dramatic, right? It's a movie dramatization. Or if you've ever seen, a man have a heart attack, it might be like that in real life, right? Where there's like clutching chest pain on the left side of his chest, his left arm is hurting, he's sweating. It's clearly a heart attack. So many big signs. But women are actually less dramatic than men. We're a lot less dramatic when it comes to cardiovascular events. Um, a woman might have pressure, she might have squeezing, she might have the left arm pain, the sweating, the chest pain, but it's usually more subtle. So women will sometimes experience really unusual or very extreme fatigue that might be going on for days or weeks before the actual event. This is like unusual for her. She can have a shortness of breath without chest pain. She's just having trouble breathing for no apparent reason. Oftentimes, women will be dismissed as having like asthma or allergies, but it's actually a heart attack happening. Um, a woman could have jaw pain, neck pain, upper back pain, shoulder pain. They might be misdiagnosed as having a gallbladder attack or a sinus, sometimes sinus issues will transfer to the jaw or clenching. Maybe I'm just stressed. You can write off all of those symptoms as something else. Very often, women will have nausea or an abdominal discomfort that feels like indigestion. She could have dizziness or lightheadedness or feeling like she's going to faint. And sometimes women will report a feeling of what is called in the literature impending doom. She knows something is not right. And this is just a nod to women's intuition. If you feel like something is not right and it feels dangerous to you, do not be dismissed. Go to the emergency department. Don't delay. And I'll tell you from a personal note, my own mother actually experienced a heart attack in her 50s, pretty young. And the the symptoms that she experienced were the indigestion, for sure, and just feeling really off. She just felt off and she had some pretty severe indigestion. She thought maybe, she'd gotten exposed to a food she was allergic to, but turned out she was actually having a heart attack. So it can be subtle. It can happen days before it ever gets diagnosed. You should also be aware of stroke symptoms, and this is true for pretty much everybody, uh, gender non-specific. But any kind of sudden numbness or weakness, especially on the face, the arm, the leg, especially on like one side of the body, any kind of sudden confusion, trouble speaking or understanding what other people are saying, having sudden trouble with coordination, balance, walking, getting dizzy all of a sudden can't, see right, having blurred vision in either eyes or both eyes. And then a sudden severe headache with no known cause. This is like, people will report to the emergency department saying this is the worst headache of my life. Well, that's immediately going to get you worked up for stroke. So stroke symptoms are sudden, fast onset, and kind of like bizarre sets of symptoms that warrants an immediate 911 call. Get yourself to the emergency room as soon as possible. So those are like pretty dramatic signs of stroke, but for cardiovascular disease developing, there can be some really subtle signs that are worth noting and paying attention to if you start to experience any of these. So getting winded, doing activities that used to be easy, having swollen ankles or feet, having any kind of heart palpitations or irregular heartbeat, which sidebar, that can be confusing because in perimenopause, that's actually a really common symptom of perimenopause. But, in keeping it in context, you should always report to your doctor if you're having heart palpitations or an irregular heartbeat. And then just this persistent, unexplained fatigue. And this is something that women will write off all the time. I'm just tired. Of course, I'm tired. I'm taking care of my aging parents. I'm stressed out at work. I haven't been sleeping well. Of course, I'm tired. Of course, I'm tired. But, it's not okay. Like, this is not a normal sign of aging. This is not something we should just accept. This is something that needs to be reported to your physician. And if you feel like you are reporting these symptoms and you're being dismissed or you're not being properly worked up, then please seek help elsewhere. The good news is 80% of cardiovascular disease is preventable. 80%. We love to blame everything on genetics, and I'm not convinced that genetics actually plays that big of a role because 80% of cardiovascular disease is preventable. So we all should be moving more, and that's at least 150 minutes per week. These are recommendations by the American Heart Association. 150 minutes a week of moderate activity. So that could be a brisk walk, but it's not a stroll. It's a brisk walk. You're getting your heart rate up. Strength training twice a week is great. I would go for 3 times a week recommendation, but even if you only did strength training twice a week, that would be really beneficial. Eating well means, reduction in processed foods and really dialing up the plants, the fiber, the fish, the whole grains, the healthy fats. If you smoke, please stop. Even if you've been a lifelong smoker, stopping smoking reduces your risk really dramatically within 1 year. So it's not something that you just need to accept, oh, I've been a smoker my whole life, nothing's going to change if I stop. It's not true. You actually could save your life by stopping within the first year. And this is, unpopular, but there's no safe limit for alcohol. There's no safe amount. Limiting alcohol is one of the most heart protective things you can do. And I would say no more than 1 drink per day and arguably less than that. Maybe 1 or 2 drinks a week max. Sleeping is so crucial. This is when your brain literally gets washed clean. This is when your gut resets. This is when your heart rests. It's so important to sleep at least 7 hours a night. Poor sleep raises your blood pressure inflammation significantly. Even one night of poor sleep increases your inflammation significantly. And you know, last but certainly not least is managing your stress. And I know that, I used to roll my eyes all the time when people would say, meditation, like I have time for that. But it's true that people that especially women who do not manage their stress, one, have a harder time through menopause, but then also this chronic stress causes a lot of cardiovascular disease. It really damages the heart, the vessels, and it cannot be overlooked. It cannot be you cannot brush that aside. You need to focus on managing your stress. That might be social connection, that might be leisure walks, that might be just unplugging at the end of the day and chatting with a friend, whatever it takes. It could be meditation, it could be, just some breathing exercises. Just take a minute to connect with yourself. And because everybody always wants to know what the ideal lab ranges are, I will put them here. Take a picture of this. Take this information to your doctor and say, I want these tests run. So these are the labs that I recommend for every woman who wants to know her cardiovascular risk. So you should ask about your total cholesterol. You should know that your LDL cholesterol really ought to be less than 100. Your HDL cholesterol in women should be higher. So in men, it can be 40, and women, it needs to be 50 or higher. So ideally, women have more HDL. It's more protective for women. Triglycerides really ought to be less than 150. My preference is that they are less than 100. Apolipoprotein B is a particle in your bloodstream that carries triglycerides and LDL into the arteries for deposition. So it's an independent risk factor for cardiovascular disease. Ideally, it's under 90, but if it's less than 100, that's pretty good too. Lipoprotein little a or LP little a, this is a genetically driven marker that everyone should have measured at least once in their life just to understand what their genetic risk really is. And ideally, it's less than 30, but even like less than 50 is good. But this just, even if everything else is spectacular, but you have an LP little a of 100, that tells me that we need to make sure you are safe. That might mean, okay, yeah, everything else is great, but I'm going to order a coronary artery calcium score on you just to make sure we're safe. Or, if you're younger and you've had this drawn and it's pretty high, that just means, hey, you need to focus a little bit more than the average person on making sure that all of those lifestyle factors are dialed in. Um, for your blood pressure, it really needs to be less than 120 over 80. So blood pressure is silent. You can't usually feel high blood pressure. There are people walking around everywhere with really high blood pressure. They have no idea. This is putting stress on the system. This is a very high risk factor for cardiovascular disease, very strong risk factor. And if you have high blood pressure, it's not a laughing matter. You need to treat it. I know plenty of people will say, they're like proud that they're not on any medications, but if you need a medication to control your blood pressure, it might save your life, right? So please don't dismiss having high blood pressure. It's worth treating. Fasting blood sugar should be 70 to 99. Again, blood sugar being elevated disproportionately impacts women's heart disease risk. And along with that, the hemoglobin A1C should be definitely less than 5.7%. You can also have HSCRP. This is high sensitivity CRP measured. This is a cardiovascular specific risk inflammatory marker. It ought to be less than 1. And then in terms of obesity, because obesity and that central adiposity is a risk factor for heart disease, it's useful to have a solid measuring tool. So I don't really like using BMI to assess weight. I don't like using body weight to assess a person's risk because, a person's musculature, a person's skeletal frame, it just might not be as accurate as it could be. And there are plenty of very healthy, active, strong women who might not fit, the what the BMI um, category says they, should weigh or what their body composition should be. So waist circumference is a really useful tool because we're directly targeting that visceral fat. So in women, it should be less than 35 inches or 88 centimeters, unless you are an Asian woman, which we know it actually Asian women should have a lower waist circumference for their health, and that should be less than 31 and a half inches or 80 centimeters. And then, based on your risk factors, it might be worth considering getting a coronary artery calcium score, maybe a stress test or an echocardiogram, just depending on your history and your risk factors. And then hormone therapy. This would just not be a Dr. Gajar talk if I did not talk about hormone therapy because I am a menopause specialist. I predominantly treat women in perimenopause and menopause, and I do a lot of hormone therapy. So what I want you to know is that hormone therapy, i.e., estrogen, may actually reduce cardiovascular disease risk, especially when started early. This is shown in the research time and time again that when started early, within the first 10 years of menopause, women have lower rates of cardiovascular disease. Now, you can still start it when you're older. There are many of us out there who are reading the literature and saying, hey, I actually think this is perfectly safe for this woman to take, even though she's been out of menopause for 10 years. But the benefits won't be as significant for her. You are a candidate for hormone therapy, even if you have high cholesterol, a family history of a stroke, or even a personal history of a provoked blood clot. Transdermal estradiol does not increase clot risk. Transdermal estradiol does not increase clotting risk. Now, oral estradiol might. The estrogen product that increases clotting risk the most is actually birth control, which, nobody's counseled about that when they're starting birth control in their teens and 20s. But oral estradiol might increase it a little bit. We know that from the Women's Health Initiative from 2002. But transdermal estradiol does not increase clot risk because it doesn't go through first pass metabolism in the liver. So it is completely safe. And, ultimately, this is an individual decision. You should be having an informed conversation with your doctor if you are considering hormone therapy. It should not be a blanket no. You should not be hearing, I don't believe in hormones. It's not the tooth fairy. It's estrogen. It's a hormone that you were exposed to for most of your life. And we aren't trying to take you back to your teens and 20s. Hormone therapy is essentially just giving some little amount of estrogen and maybe progesterone and maybe testosterone back to your body so that you can continue living the rest of your hopefully long life because, we're outliving our ovaries, right? That doesn't mean we should just suffer for the rest of our lives and be forced to take all of the medications that probably hormone therapy might be able to prevent. And that's the end of that soapbox. I will move on. I am obviously very passionate about this. So, bottom line, the menopausal transition is a very critical turning point in a woman's health. And if you don't focus on your wellness now, we will be treating your illness later. So think about that. If you don't think you have the time to get your annual checkup, if you don't think, you have the energy to talk to your doctor, focusing, avoid failing to focus on your wellness now will lead to illness later. So think about that. Schedule your annual checkup. Get the blood pressure check, get the blood sugar check, get your lipid panel done. Talk to your doctor about those pregnancy complications you might have had or your family history of early heart attack, any symptoms you might be having. And then be very direct. Ask, what is my cardiovascular risk? And if anything feels wrong, if you feel like you're being dismissed, really push for answers and don't hesitate to get a second opinion if you don't feel like you're being heard or taken seriously. And get really serious about treatment. Medication interventions like blood pressure medication saves lives. So please don't feel like you have to suffer or that there's something wrong with you if you need to treat a medical illness. It's not weakness. It is just it's just where you are at this moment. And getting on the right treatment may very well save your life. So thank you so much for listening. I hope this was informative. I hope you feel empowered to go forward, talk to your doctor. And I hope you will also consider donating to the American Heart Association's Women of Impact campaign. This campaign funds critically important research for cardiovascular disease in women. So all those unknowns about women and heart disease and how do we take care of women, how do we prevent women from dying from heart disease, we can answer those questions with the right funding. So I really hope you feel called to just scan the QR code, make a donation of any amount, and thank you so much for your contribution. My contact information is at the bottom. Don't hesitate to reach out if you have any questions and if I can help you at all. Thank you so much, and I wish you all the best.